Come in.
Hello, how are you today?
Good. How about you?
Good. My name is Lindia. I'll be your nurse today. Wash my hands and provide privacy. Can you verify your name and date of birth?
Andy Wang.
Is it okay
August
if I touch
3rd,
you?
1987. Yes, ma'am.
Okay. And so the doctor put in some orders today to do a full head to toe assessment. Is that okay?
Sounds good.
All right. So we've already did your vitals and we've also did your pain assessment. So the first thing I'm going to start with is the Glasgow Coma Scale, and that assesses your level of consciousness. So I'm gonna ask you some questions, okay?
Okay.
What is your first and last name?
First name Andy, last name Wang.
Where are you at?
A hospital.
What's today's date?
March 3rd, 2023.
Okay, good. And so you are alert and oriented times 4. Patient knows where they're at. They are well groomed. Dressed well for the weather. I'm gonna also check your skin while we're doing this. Skin is pink, moist, no skin rashes, bumps, lesions, or anything. Nails are nice and trim. All right, I'm also check the skin tugger. All right. Any questions so far?
Nope.
All right, so I'm also gonna start at your head. All right, can you bend down for me? I'm kind of short. No balding, no lumps, no alopecia or anything. Have you been having any headaches?
I have not.
No? Okay. All right. So next thing I am going to check is your eyes. First thing I'm going to do is check your pupils for reactiveness. Okay. So just look straight ahead. All right. And I'm going to also have you stare off into space, focus at an object, and look back here. I'll tell you when, okay? Okay, look now. All right. So I'm also check your pupils for the size. And I'll say your pupils are about a 4. And pupils are equal, round, and reactive to light. Have you had any loss in your vision?
Nope.
Any blurriness?
Nope.
Nope. Okay. All right. So I'm also gonna check your ears. Any ear drainage? Any loss of hearing?
No, ma'am.
No. Okay. I'm gonna also do the whisper test on you. I'm gonna say 3 words and you just repeat them back to me. Okay.
Okay.
All right.
I like food.
Okay. Good. All right. Next thing I'm gonna do is check your nasal patency. I'm gonna have you hold one side of your nose, breathe in and out. Other side. All right. Any allergies? Look up for me. All right. So I'm also gonna check your oral mucosa. All right. Open. All right. No dental caries or anything. I'm gonna have you swallow for me. All right. Any difficulty swallowing? All right. Good. So the next thing I am going to move on to would be your respiratory assessment. All right. Any shortness of breath?
No, ma'am.
Difficulty breathing?
No, ma'am.
All right. I'm gonna also have you turn to your right side, deep breathe and cough. All right, good. So, first thing I'm gonna do is start at your right upper lobe. Deep breath. Left upper lobe. Left lower lobe. Right lower lobe. All right, I'm gonna have you cross your left arm over your right shoulder. And this is your left lower lobe. Deep breath. All right, and same thing with your right side. Deep breath. All right, now I'm going to do your posterior lung sounds, starting with your right upper lobe. Deep breath. Deep breath. Left upper lobe. Left lower lobe. Deep breath. And right lower lobe, deep breath. All right, any questions for me so far?
No, ma'am.
All right, and I will also have you breathe into a spirometer 10 times per hour, okay? Respirations are 14. They were equal, unlabored, no accessory muscles used, and no adventition sounds. Okay, so the next part I'm going to do is your cardiac assessment, okay? So, do you have a family cardiac history?
I do not.
Any chest pain?
No, ma'am.
All right. So, first thing I'm going to do, sit up for me. I'm going to start at the second right intercostal space. That's the aortic. Then I'll move over to your pulmonic. Move down to your herbs point. And I'll move to your mitral valve. Oh, tricuspid. And last will be your mitral valve. And I also would assess the apical pulse for a minute. Can you stick your hands out for me? Turn your hands over. Checking for capillary refill. Capillary refill is less than 3 seconds. Check for edema. No edema. Checking your lower extremities. No edema. And so I also would check your pulse in your dorsalis pedis. Your this is popliteal. This is your posterior tibialis. Your femoral. Your radial pulses. Brachial, axillary, and your carotid. Also, while you're sitting there, turn your head to the side and check for jugular vein distension. You have none. Okay. Any questions? No? Okay. So moving right on along. Not the last thing. Oh, also too, I would hear the S1. S1 will be your lub, and S2 will be your dub. And I would listen for murmurs with the bell of the stethoscope. All right, which would be S3. So next thing I'm going to do is your gastrointestinal exam. When was your last bowel movement?
This morning.
This morning, okay. Have you had any difficulty urinating? Any changes in smell or color? No? Okay. First thing I'm going to do is inspect. Okay. And I'm going to auscultate before I palpate. First, I'm going to start in the right lower quadrant. Right upper quadrant. Left upper quadrant, and left lower quadrant. And if I heard any abnormalities, I would listen for 5 minutes. Okay? All right. And so the next thing I am going to do is a gait test. Have you had any recent falls?
No, ma'am.
No? Okay. So first I'm going to check your range of motion. Sit up for me. I'm going to do your elbow. All right. Flex for me. All right. Now extend. Same thing with your wrist. All right. Relax it. And with your knee, extend it for me. Now flex. One more time so I can check for crepitus. Okay. And same thing with your ankle. Extend it for me. All right, flex. All right, good. So I'm also gonna have you stand up, and I'm going to do a gait test. I'm gonna have you stand here for 30 seconds. Well, a few seconds with your eyes closed, okay? All right. All right, open your eyes. Did you feel any dizziness? Do you feel like you were rocking? Okay. So I'm also gonna have you walk from back here, heel to toe, all the way to the door. All right, ready? All right, good job. All right, and I believe that is about it. Do you have any more questions for me, Mr. Wayne?
No, ma'am.
All right, well, that is all, and the doctor will be in just a second, okay?
Thanks.
All right, thank you.